and welcome to my neurological assessment. My name is Philomena, and I have Mr. John here to help me with the assessment. First of all, I'll start to check for his alertness and orientation. I'll ask him some few questions to make sure that he's alert to time, place, and person. Can you please tell us your name?
No, my name is John Mills.
Okay. What time is it?
It's 7 p.m.
And can you tell us where we are?
We are home.
Okay, good. So he is alert and oriented to time, place, and person. I'll start with the cranial nerves, checking for the cranial nerves now. I'll start with cranial nerve 1, which is the olfactory. I'll give him something to smell, and then he's going to tell me what scent it is. Can you smell this and tell me what it is?
Yeah, that's strawberry.
Okay, good. So that means that this cranial nerve 1 is intact. I'll go on to the cranial nerve 2, and then using the Sneller's chart, I will check his right and then the left eye for visual acuity and for distance vision. And then I'll also check for near vision. So I'll give him something that has little paper print 14 inches away from his nose to read and tell me what's on the paper. So can you bring this a little closer to you and read what's on it?
Who are you? Who are you?
Okay, that's good. So that means that the cranial nerve 2 is intact. Also, I'll go ahead and do a confrontation test. I'll have him cover one eye, and then I'll also cover my eye, and then I'll check for peripheral vision. So can you cover one eye? I'll also cover it. Tell me, I'm going to wiggle my hands. Tell me if you see them.
Yes.
Can you see it now?
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 Yes.
Good. So that means that peripheral vision is intact using the confrontation test. Okay, so back on the cranial nerves, I'm going to check cranial nerve 3, 5, and 6. I'm going to use a light source and check his eyes, the pupil for reactiveness to light and equality. So I'm going to shine this light on one eye. Good. When I shine it on, the pupil's constricted. Now I'm going to shine it on again and look at this eye. And the pupils constricted as well. So his pupils are equal, round, and reactive to light, both directly and consensually. Now I'll also check for accommodation. I'll have you look across the room and then follow my hands as I bring it. So accommodation is also intact. His eyes converged and constricted when I had him look across and brought my finger to the eye. So that means there's positive accommodation and your pupils are equal, round, and reactive to light and accommodation, both directly and consensually. Now I'm going to check for the muscles of the eye. I'm going to make another big H and with my eyes, and then you tell me if you see it, you can follow it. So follow my hands. Good. So that means that his eye is intact with no nystagmus. So I'll go ahead and check for the cranial nerve 5, which is the trigeminal nerve. I'm going to check for strength. First, I'm going to put my hands on the temporal bone and the maxillary bone and have the patient clench his teeth, and then I'll see the strength that he has. So clench your teeth for me. It's good. And then on the maxillary, it's good as well. So now I'm going to check for sharpness and dullness using an object. I'll have the patient close his eye, and when I pinch, I'm going to pinch on the hands and on the chest and some part of the face, and then he's going to tell me whether the object is sharp or dull. Can you please close your eyes? I'm going to touch you, so you can open for now. So this side is going to be sharp, and this side is going to be dull. So when I touch you and it's sharp or dull, you tell me with your eyes closed. Okay, so is it sharp or dull?
Sharp. Sharp.
Okay, so that means that the sharp and dullness test was positive. Okay, so next I'll check the cranial nerve 7, which is the fascia nerve. So I'll have you raise your eyebrow. Good. And then I'll have you close your eyes really, really tight. I'm going to try to open it. Don't let me open it. So close your eyes really tight. Good. And then I'll have you smile. Good. So you have positive facial symmetry. And then I'll go ahead and check cranial nerve 8, which is the acoustic nerve. I'll have you occlude one of your ear, cover one of your ear. I'm going to whisper some words to you and then repeat those words after me.
How are you?
Okay, good. So that means that the acoustic nerve is intact. Next, I'm going to do the Rivier test and the Weber test. And I'm going to use this as my tuning fork. With the Weber test, I'm going to activate the tuning fork and I'll put it in the center of your head. Tell me if you can hear the sound in one, either the left or right or both ears. Okay? So, I'll activate it and I'll put it. Can you hear it?
Yes.
In
In
both?
both ears. Yeah.
Okay, good. So that means there's positive Weber's test, and then I'll go ahead and do the Rivier test. Now I'm going to activate it again, and I'll put it behind your ear. That's the mastoid bone. And then tell me when you cannot hear the sound anymore.
I don't hear the sound anymore.
Okay, good. And then I'll bring it to your facial side. Okay, good. So that means that your air conduction is greater than the bone conduction. So back on the cranial nerve, I'm going to check cranial nerve 9 and 10 now. Now, using the light source, again, I'm going to have the patient open the mouth, and then I'll look for the soft palate and the hard palate. So I'll have you open your mouth and say, ah. Good, so that's good. And then if I had a tongue depressor, I will check for the gag reflex. I'll use the tongue depressor to touch the soft palate, and the gag sound should be heard for the gag reflex. So I'll move on to cranial nerve 11, which is spinal accessory. The spinal accessory nerve. I'm going to put my hands on the patient's shoulder, and then I'll have him move, and then when I'm done, I'll have him put it on the jaw and then move against my hand. So I'm going to put my hand here. Can you move against my hand? Good. And then I'm going to put my hand here as well. Good. So that means that the cranial nerve 11, which is the spinal accessory nerve, is intact. So to the last cranial nerve, which is cranial nerve 12, that's the hypoglossal nerve. I'll have the patient bring out his tongue and stretch it out, and then we'll see if it's symmetrical and midline. So can you pull out your tongue? Good. So the tongue is midline and it's symmetrical. Okay, so the cranial nerve 12 did it for the cranial nerve, so we are done. We are going to now move on to checking for motor strength. I'm going to have the patient walk towards you some few steps, and then walk again from using the heel to toe steps. So I'll have you walk a couple of steps towards him. Good, good. So you can come back, and then now can you walk using your heel to toe, a couple of steps. Heel to toe, heel to toe, heel to toe, which is good. Okay, and then, so that means that you are upright and steady during your movement, which is good. So now I'll have you bend your knee.
Yeah.
A couple times, good. So that means your knee is strong and nice. And then I'll have you stand on one foot. Good. And then the other foot, which is good. So now I'm going to have you with your eyes closed. You're going to